Hello, I am a postdoctoral research fellow in the Center for Healthcare Delivery Science at Nemours, and I'm really excited to share some work that I have ongoing. Today I'll be talking about psychosocial risk screening in pediatric cerebral palsy.
Nicole, somehow you got muted.
Oh, there we go. I have a new keyboard, so
we'll let you know if it happens again.
Cerebral palsy is the most common motor disability in childhood. We estimate that it affects approximately 1 in 345 children in the U.S. We know that rates of CP are higher for children who are born preterm, those who are born low birth weight, and those babies who are born in multiples, so twins and triplets. CP is really an umbrella term for a group of disorders that affects a person's ability to move and maintain their balance and posture. And it also affects other bodily functions that involve our motor and our muscles. So things like breathing, bladder control, bowel movements, eating, and talking. In addition to these motor challenges, we also know that youth with CP are at an increased risk for experiencing psychosocial challenges. So they experience higher rates of emotional, behavioral, and social disorders compared to those without CP. We also know that CP impacts family functioning overall. So for family functioning, we know that parents experience worse depression, anxiety, and poorer quality of life compared to parents of children without CP. And while many families are resilient to these challenges across time, all families experience some distress and difficulties, and they would likely benefit from some psychosocial support to help reduce the burden and improve the quality of life. So, as of currently, we know that the psychosocial needs of our families with youth with CP are not currently systematically assessed. Systematic psychosocial risk screening would allow for screening all of our families in an inclusive manner. It would help to identify those families who are most in need, and it would also help to further appropriately allocate our psychosocial supports and resources. Because we all know that they are hard to come by. So for those who aren't familiar with the PAT or the Psychosocial Assessment Tool is a brief caregiver report validated psychosocial risk screener that was originally developed for use in pediatric oncology. However, across time, it's been adapted for a variety of other medical conditions. And so the PAT is a broad screener that assesses stressors, also known as psychosocial risks, and resources for families. And then it categorizes family based on the pediatric psychosocial preventative health model, which is shown on the slide here in this 3-tier model based on need of family. So just to give some background on some research that was done prior to the ongoing study that I'm talking about, we did complete 2 studies. So the first was a review of the literature, and the review of the literature did support that there is a need for an evidence-based screening tool within pediatric CP. And then the second part of our study was looking at some qualitative interviews with multidisciplinary healthcare providers within our Nemours CP Center. And with these qualitative interviews, our providers did support using the PAT as a screening tool. However, they did a really nice job of highlighting some areas of improvement and adaptation for a CP specific screener. So they mentioned things like adding more questions about motor functioning, mobility related challenges, co-occurring medical diagnoses, as well as family beliefs related to CP challenges. So based on that information, we went ahead and developed some kind of pilot items to add to the PAT in our adaptation. And that brings me to our current work. So I'm currently working on a 2-year fellows project funded through the Nemours Biomedical Research. And our overall goal is to validate the PAT as a measure of psychosocial risk for our families with CP. So here is our sample across all the aims of our study. And I'm going to just jump into the aims. So our first aim, which we're currently recruiting for, is to incorporate our family voices into the adaptation of the PAT-CP. We're currently recruiting 30 primary caregivers, and these caregivers are being asked to complete a draft of our PAT-CP, as well as then participate in a qualitative semi-structured interview to provide feedback on that content. Following analysis of this qualitative data, we will make any additional changes and adaptations to the measure. And then once we've completed that, we'll move into our second, third, and fourth aim. And so this will be to validate the measure as a psychosocial risk screener across a 12-month period. To do this, we're asking about 150 families to complete the PAT, as well as a battery of questionnaires of relevant areas across 3 time periods. So baseline, 6 months, and 12 months. Additionally, we are going to be conducting some exploratory analyses. So we'll be looking at if there are differences in the PAT-CP scores relative to the severity of CP, as well as the timing of CP-related surgeries. We chose CP-related surgeries because this can be a pretty stressful time for families pre and post surgery. And then we'll also be looking at the PAT-CP risk scores and how it is associated with other healthcare variables. And then just to shift gears a little bit, so we know that CP is more prevalent among our non-Hispanic Black youth compared to our non-Hispanic white children. We know that spastic CP, which is the most common subtype of CP, is found to be higher among our non-Hispanic Black youth. Racism may be a principal driver in these health inequities, and experience of these race-based stressors may be an important aspect of understanding psychosocial risk. And so it's really critical to understand how things like perceived discrimination can impact both psychosocial outcomes for families as well as its relation to healthcare. So that brings me to the last aim of this study, which is examining how perceived racial discrimination is related to PAT scores. To do this, we are asking families to complete 2 specific questionnaires about racial discrimination. So the first is called the Daily Life Experiences Scale. This is a self-report measure that asks families to report on experience of perceived racial discrimination. These are just a couple questions that I pulled from the questionnaire just to give you an idea. And then the other question that we'll be having families answer is, was your child ever treated or judged unfairly because of their race or ethnic background? So those are the 4 aims of our current study. However, we're already kind of thinking about what's next for this line of research, and we'd really like to move in the direction of implementing the PAT-CP as a psychosocial risk screener. We hope that this will help to early identify multiple risks for children and families, and also help to develop and deliver evidence-based psychosocial care for our families. Again, really focused on matching the needs of our care to the families and what is most crucial for them. And then we're also hoping that some of this initial data that we're collecting in terms of racial discrimination and PAT scores will help us to move towards developing culturally tailored interventions for our families, also aimed at reducing psychosocial risks. And then lastly, I just want to say thank you to my team, so my primary mentors, Ann Kazak and Wade Schrader, who is our CP in our CP center here at Nemours, and our CP team. Thanks.